What is the difference between functional and organic child constipation? Imagine your child is sitting on the toilet, trying to go, but nothing happens. Sometimes understanding why can be tricky, but knowing the difference between functional and organic constipation can help. Functional constipation is the most common type in children. It happens without any physical problem or disease causing it. Instead, it often comes from behavioral issues. For example, a child might hold in their stool because they are afraid of pain or uncomfortable using certain toilets. Sometimes they don't recognize when they need to go or are reluctant to use unfamiliar bathrooms. After a gastrointestinal infection, some children might develop this type of constipation as well. Children with functional constipation usually pass large, hard stools less often than normal, and they might have pain during bowel movements. Sometimes, they even have accidents because stool gets stuck in the colon and causes soiling. This type of constipation is called a functional disorder because it's related to how the body and mind work together, not because of any physical abnormality. It accounts for about 95% of childhood constipation cases. Organic constipation is different. It is caused by an actual medical problem affecting the digestive system or related parts of the body. These problems are rare but important to recognize. Conditions like Hirschsprung disease, which is a birth defect where nerve cells are missing in part of the colon, can cause organic constipation. Other causes include celiac disease, hypothyroidism, spinal cord issues, neuromuscular disorders, or problems with the anus. Organic constipation often starts very early in life, sometimes within the first few days after birth. It may be linked to poor growth, swollen belly, or abnormal findings during a physical exam, such as unusual muscle tone or reflexes around the anus. To sum up, functional constipation mostly results from habits or behavioral issues and is very common in children. It usually develops after they start toilet training or due to emotional factors. Organic constipation is caused by physical or medical problems and is much less common. When a child has severe or early onset constipation, or if there are other signs like poor growth or abnormal physical findings, a doctor will look for underlying causes through tests. Understanding this difference helps doctors decide how to treat. Functional constipation is often managed with changes in diet, encouraging good toileting habits, and sometimes using gentle laxatives. Organic constipation, however, needs specific treatment for the underlying condition, which might include medication or surgery. If your child is having ongoing constipation, it's important to see a healthcare professional. They can evaluate the situation properly and recommend the best approach to help your child feel comfortable and healthy.